What are the risks of Hartmann's procedure for diverticulitis? Imagine facing a serious infection in your colon that needs urgent attention. Hartmann's procedure is often used in such cases to remove the diseased part of the colon and create a colostomy. While it can be life-saving, it is not without risks. About 1 in 5 patients may experience complications during or after surgery. These can include wound infections, where the surgical site gets infected, or anastomotic leakage, which is when the connection between the remaining parts of the colon leaks if a reversal is done later. Other common issues are ileus, which is a temporary blockage of the intestines, and hernias at the site of the colostomy. Infections outside the wound and abscesses inside the abdomen are also possible. Medical complications such as heart or lung problems can occur, especially in patients with other health issues. The risk of death from the surgery varies but can be around 3 to 8%, particularly in emergency situations or in patients who are already weakened. If the surgery is successful, some patients may later have a second operation to reconnect their bowel, called a reversal. This second surgery also carries risks. About 3 to 4 out of every 100 patients might experience leakage at the reconnection site, which can cause serious infections. Wound infections and diarrhea are other possible complications after reversal. The reversal surgery has its own complication rate, which can be around 16%, and in rare cases, it can be life-threatening. Not everyone is a candidate for reversal, especially if they are in poor health or had complications from the first surgery. Recovery can take time. Patients often spend between 11 and 23 days in the hospital, depending on their condition and any complications. The process can be demanding, especially for those who are already weak from infection or other illnesses. Other risks include ileus, which is a temporary paralysis of the bowel, and hernias that can develop at the colostomy site, sometimes requiring additional surgery. Serious but rare complications include septic shock and multi-organ failure, especially if leakage occurs after the reversal. In summary, Hartmann's procedure is a vital option for treating complicated diverticulitis, but it comes with significant risks. These include infections, leakage, longer hospital stays, and even the chance of death. The risks are higher if the surgery is done in an emergency or if the patient has other health problems. Deciding on the surgery involves carefully weighing the benefits of removing the diseased bowel against the potential for complications. It is essential to work closely with healthcare professionals to manage these risks and ensure proper follow-up care. Always consult your doctor for personalized advice and treatment options tailored to your specific situation.